Wish TV is focusing on the racial disparities in the healthcare system.
Yeah, tonight the leaders of 4 hospital systems in central Indiana discussed why racism is a healthcare public health crisis, rather. Danielle Zulkowski breaks down the Health Spotlight special.
Racism is a public health crisis. It's a declaration made by over 250 governments and organizations, and something healthcare systems across Indiana have vowed to address. 6 governments in Indiana have made this declaration, including the Indianapolis City-County Council. Community Health, Franciscan, IU Health, and Eskenazi Health are all working together to help improve access to health care and outcomes.
By limiting opportunities for education and jobs and housing and transportation and nutrition and health care has negative impacts on health. These social determinants span across generations.
Looking at how our patients, how they feel secure and safe within our walls, that's important. But also looking at our communities that are marginalized and making sure that we are aligned and we are hearing.
This is the first time this program was broadcast on TV. This is the 3rd installment of the panel, originally created by the Indianapolis Recorder and the Greater Indianapolis branch of the NAACP.
It's important to me because as a person of color, I see it and I can experience it firsthand. I have relatives, I have friends, I know people in the community that call us and they complain that they have not been treated fairly in a hospital.
It's good that the hospital CEOs are speaking about this, coming in, because it shows us just how serious they are, and sometimes things start from the top to the bottom.
The panel unveiled data for the first time collected by the We Ask Because We Care program, where providers collected information about patients' race, ethnicity, and language.
If people are feeling reluctant or skeptical, as Dr. Harris suggested, to provide us with that data, then we have these gaps, right? And we may be drawing incorrect conclusions.
So having a robust data set to understand where we are and where we would like to go is so important, so that we're all talking the same language. We're talking about the same measures of success and understanding where the differences are.
The panel said this data is about making change in the healthcare system for the future.
Having a set of interventions that make a difference, I think that's what all of us are seeing this data begin to tell us, is where do we need to build interventions, and ideally, as years go on, are the interventions effective?
How do you treat it? And how do you educate people that these are not abstract numbers, blood pressure and glucose numbers? They're risk factors for having a heart attack and a stroke and all the things that Dr. McGill said. So that's the education that has to happen.
The program was summed up by reminding everyone to continue to communicate to help affect change. In Indianapolis, Danielle Zulkowski, Wish TV, wishtv.com, and follow us on Facebook.